Hello, welcome to the second session of Doctor's Talk. Myself Vrinda. Today we have with us Dr. Ajesh M. Pillai sir, Director, Ahalya Wellness Center. Welcome to the session, sir.
Thank you very much.
Today we are dealing with the topic rheumatoid arthritis. So my first question is, sir, what is rheumatoid arthritis and what causes rheumatoid arthritis?
Rheumatoid arthritis is basically an autoimmune disease. So what is autoimmune? Like, see, we have a defense system in our body which is meant to ward off other diseases. So we have an immune system, so we don't catch diseases. It is meant to fight viruses, bacteria, and all these things. But sometimes the autoimmune system in the body, it goes out of control. Supposing maybe due to some allergies, some kind of fulminating cause, some stimulus, it goes out of control, and this autoimmune system, that is our WBCs and our white blood cells, they start attacking our body itself. So this is known as autoimmune diseases. Mainly, the autoimmune system affects the joints of the body, and therefore we have what is known as rheumatoid arthritis.
Okay, sir, what causes this rheumatoid arthritis?
The exact cause of this disease is not known. But in Ayurveda, we have a number of theories in which we say that there could be a Srota which causes this condition. But generally, there is a fulminating cause. It could be a viral infection, it could be a genetic predisposition, or also it could be some kind of infection that the body has at an earlier stage. Then we develop a kind of allergy which causes this disease, rheumatoid arthritis. Yeah.
So my second question is, what is the best indicator of rheumatoid arthritis?
In rheumatoid arthritis, the main symptoms, the first symptoms are pain in the small joints of the body. It normally happens in the phalanges of the fingers. It can happen in the wrist. So you have a uniform bilateral kind of a pain, and this pain can be shifting. So a mild night fever, which called a mild fever, fatigue, then a loss of appetite, a general weakness, and a malaise and pain. These are all normally the first symptoms of rheumatoid arthritis. And if it is checked in that time itself, it can be cured properly.
Which are the diagnostic criteria and relevant blood investigation of rheumatoid arthritis?
There are symptoms, first of all. When these small symptoms come in, like you have pain in small joints, a malaise, a low-grade fever, we could always be suspicious of rheumatoid arthritis. And once we are suspicious, we go in for further testing. These testings include ESR of the body, it could be CRP testing, it could be ACCP testing, and also RA factor is a very important test. But in many cases, it is seen that even though the testing is negative, people can have these conditions, in which we call it seronegative arthritis. So there is a group of symptoms. If you have more than 5 or 6 of these symptoms, we can call it an arthritic case without the testing being positive. So that is the general accepted condition.
What are the food that to be avoided in rheumatoid arthritis?
Before that, once you have this rheumatoid arthritis, after symptoms, the main problem is that initially it starts affecting the covering of the bones, the cartilages, the collagen fibers. And at that time, if you're able to control your food properly, take medicines properly, we will be able to control this disease. In modern medicine, rheumatoid arthritis is not a totally curable disease. It is a maintainable disease. But in Ayurveda, with proper treatment and care, we can cure the disease, although it may take some time. So the foods generally are, a gluten-rich food should be avoided. And then antioxidants and anti-inflammatory medicines like turmeric, ginger, these should be promoted in your diet. And unwanted foods, hotel foods, fast foods, these all should be avoided. And excessive proteins at certain times can cause flaring of this condition.
Okay, sir. What is the most successful treatment for rheumatoid in Ayurveda?
So first of all, we have to look at both the aspects in Ayurveda and in modern medicine. So before coming to the Ayurvedic aspect, I will mention a few drugs in modern medicine. In modern medicine, rheumatoid arthritis has been mentioned as a disease which cannot be completely cured. It can be maintained. So there are 2 lines of treatment. One is the non-steroidal drugs, that is like paroxicam, brufen, these kind of painkillers are given. And then we have DMARDs, that is disease-modifying drugs. Drugs like sulfasalazine, HCQs, methotrexate. These are the disease-modifying drugs that are normally given in modern medicine. Then also there are drugs that go into the realm of immune suppressants like cyclosporins, tofacitinib. These are the mainstay causes in modern medicine. In Ayurveda, because I have said at the start itself, it's a Srota condition, which we call Amavata. Ama is generally causing this Srota. So the first step in Ayurveda would be to remove the Amatvam of the body. That is, we give medicines by which we can increase the appetite of the body, remove the srota roda, and give medicines that are pajanam and deepanam in what's about that effect. So drugs like amurdotram kashayam, then what's about that ulichadi kashayam. Deepanam kinds of drugs are given first. Body is made pure, and then we go for the main Shodhana Shamana Chikitsa, which will cure this disease.
Can a person fully recover from rheumatoid arthritis?
If you're able to catch this rheumatoid arthritis in the early stages, like there are 4 stages in rheumatoid arthritis. One is early early RA, then is moderate RA, severe RA, and end stage RA. If you're able to catch the disease in the first stage, that is the early RA, and also in the second stage, also moderate RA, we will be able to completely cure the disease with Ayurvedic medicines. Once it crosses that level and it causes bone deformities, then maintenance is the only thing. We can maintain the disease and the person can live a life without pain. He'll be comfortable.
What is the best exercise for rheumatoid arthritis?
Rheumatoid arthritis basically is an inflammation of the joint. So when we call arthritis, it's simply arthrositis, that is inflammation of the joint. So exercises should be limited. In a sense, it's not cause overstrain to the joint. So non-effortive kind of exercise like swimming. These are the best kinds of exercises, and too much of weightlifting and too much of excessive weight-bearing exercise should be avoided. Do mild exercises. Yoga is a very good form of exercise. So avoid stress to the joints and do a mild exercise. That is the best thing.
Okay, sir. So this is the last question of the session. Can a normal person identify and differentiate rheumatoid arthritis, osteoarthritis, and gout by simply examining the appeared symptoms?
For a common layman, it may be difficult. It may be difficult because any pain that comes in, he may complain about joint pain. So normally people say it's a degenerative condition. So initially, it is possible to understand rheumatoid arthritis if you know the basic things. A low-grade fever, malaise, loss of appetite. These kind of things are the early precursor signs of rheumatoid arthritis. Then finally, you'll be having joint pains, like mainly the pain starts in the phalanges, wrist, and these kinds of things, and also in the lower ankle joints. So if a patient is able to distinguish these things, he'll be able to understand he's having rheumatoid arthritis. But as the time progresses, this rheumatoid arthritis, initially the bursitis happens, the collagen fiber destroys itself, and then it finally reaches the bones, in which rheumatoid arthritis can convert itself into osteoarthritis. Then later on, even that joints will start degenerating. So initially, if you have these symptoms of malaise, low-grade fever, pain in joints, and normally shifting pain, you can understand you're having a rheumatoid arthritis, but it's always better to consult a doctor and go for further testing.
Thank you, sir. That was the end of today's session. Thank you all for watching.
Ahalya Wellness, the future of Ayurveda.